Gastrulation is the process by which the bilaminar embryonic disc is actually converted into a trilaminar embryonic disc. This happens at 3 weeks. So again, easy to remember, bilaminar 2 weeks, trilaminar 3 weeks. Having said that, when the embryo is 3 weeks old, many women don't even realize that they're pregnant yet. So let's backtrack. She had her last menstrual period, ovulated about 2 weeks later, and fertilization, implantation, and now 3 weeks later. So instead of starting menstruation a week ago, we are at the trilaminar embryonic stage 3 weeks into the pregnancy. The reason I bring this up is because board exams can confuse you. I just taught you the simple mnemonic, nice one, 2 weeks bilaminar, 3 weeks trilaminar, but that's the age of the embryo itself, what we call the fetal age. If you're asked of gestational age, which is the time from the last menstrual cycle, please remember that that's actually 5 weeks for a 3-week-old embryo. Basically, 2 weeks before conception occurred. Never forget this. If I had to identify the most common reason students get embryology questions wrong, it's confusing gestational age and fetal age. Okay, back to our gastrulation. That happens in week 3, fetal age. And gastrulation begins with the appearance of a thickened linear band called the primitive streak on the dorsal or the back of the embryonic disc, due to cells from the epiblast proliferating and migrating towards the median. This initial streak elongates by addition to the caudal end. So if we have a look at this from above, you can see where the primitive streak is starting on the caudal end, and on the opposite end is what we call the precordial plate, which is on the cranial side of the disc. As these cells proliferate, they create a groove within the primitive streak, and the tip of the streak is still growing towards the caudal end, out into what we would call the primitive node. The epiblast cells migrate through the primitive groove to become endoderm and mesoderm. The layers of the mesoderm is a loose connective tissue known as mesenchyma. Some mesenchymal cells migrate cranially from the primitive node and pit, forming a median circular cord. And this median cellular cord, the notochord process, or the notochord, keeps moving until it reaches the precordial plate on the cranial end. The primitive streak itself actively forms this mesoderm until about the 4th week, and then its production slows down and it actually starts diminishing in size relative to the newly formed notochord structures. In summary, the trilaminar embryonic disc is formed through the appearance of this primitive streak, the development of the notochord, and differentiation of these germ layers. The 3 germ layers contribute to the formation of completely different tissues. This lovely image summarizes the differentiation in a nice single snapshot. We will cover in more detail when we discuss the embryology of the different organ systems. So please, please, please do not try to memorize everything on this chart right now. In broad strokes, what I do want you to know or take away from this is that the entire trilaminar embryonic disc comes from the epiblast. The endoderm, and endo means inside, is the part that forms the innermost linings of the body. So think the epithelial lining of the gastrointestinal tract and the epithelial lining of the pharynx, of the trachea, of your lungs. The mesoderm gives rise to connective tissue, blood vessels, and muscles, while the ectoderm can be thought of in terms of surface ectoderm on the outermost skin, epidermis, for example, the hair, and even the enamel of your teeth. While there's also neuroectoderm, the second form of ectoderm, which forms into the neural tube, what I like to call the nervous system that mostly stays in place, okay? And the neural crest cells, which are the pieces that would migrate into other parts of the body. Again, we'll discuss all of this a lot more as we look at each organ system.